I'm Rhonda. I'm with the Denver Moms Blog. We are here today with our partners with Health One at Rocky Mountain Hospital for Children. I'm here with Dr. Sarah Lai, Anna Davis, and Dr. Saundra Kay. We are here today a little bit different than what we've done in the past. We're going to talk about motherhood and working and what it means to find that balance between being a working mom, being a good mom, being a good partner, and all of that today. So welcome.
Thanks for having us.
So glad you girls could be here.
Yes.
Ladies, sorry. We're going to dive right in.
Okay.
So before having children, did you know that you would want to work, and how did that affect when you had children?
So I always knew that I wanted to have a family, but in terms of being in medicine, it was really just trying to balance when I would be able to have kids where it wouldn't affect, my training and moving around and whatnot. So I think it's actually relatively common for people who go into medicine, especially surgeons, where they might actually end up having kids in a more delayed fashion compared to kind of the usual cohort. But I always knew that I wanted to have kids.
Yeah, I'm the same way. I'm the oldest of 6. So I feel like I've been a mom since my younger siblings were little. My mom worked growing up, so for me it was definitely something that I saw and admired about her and wanted to do myself. And got married at 25 and had my oldest at 27. So I feel like I condensed it maybe a little bit more than these two lovely ladies.
I definitely knew I wanted to have children. And I also knew that I did not want to have children during my training, and that's just my own personal preference. I know that a lot of doctors do decide to have their children during their residencies, and I don't think I could have handled it, so good on you for handling it. And so I waited until I had been in practice for a couple of years before I had my kids.
Well, I don't know about you, but I feel like I am sometimes a better mom when I am working, and I hope to show both my boys and my girls, the strength that we can, it's not that we can do it all, but definitely that we can find that balance.
I agree. I think, I just feel like I hope they see it that I am a good role model for them, for my daughters and for my son. So I agree with you 100% on that.
Yeah, and I think the realization that motherhood comes in a lot of different forms, and you can do it a lot of different ways, whether you want to work part-time or full-time or stay at home. It's really what works best for you and for your family. And so I love the fact that, my mom worked part-time when I was growing up, so I feel like I got exposed to that. And then my friends who either stay at home or work part-time, that my kids are exposed to families look very different based on what works for you and for them.
Well, and I really, like you said, it's really what's important to your family and what's going to work for you,
right,
more than anybody else. It doesn't matter what's working for you, may not work for me, and just finding what's important for your family.
I think the great thing about this work environment is that our practice actually does encourage work-life balance, and the hospital encourages that as well. So I think it's important that they know that we have to spend time with our families, and it's not this expectation that we're just 100% here all the time, because that's how it leads to burnout and whatnot. So I think it's important.
Well, that is so important, to find a place where they do value your balance, because you're a much better human being. You're a better provider when you have that love in your heart for your family, because that way you can really relate to them, I feel like.
That's one of the reasons actually I ended up coming to this job, is because I could see that my now partners really valued family time, and this is the men as well, the fathers and the mothers. And that was really important to me, so that's why I've been here now for 15 years.
That's a pretty good indication of importance. What's one thing that you wish that someone would have told you about being a working mom that maybe you didn't know, especially going in?
Maybe just don't expect that you're going to be perfect at everything all the time, and that's okay. I think the biggest thing is that's okay.
Yeah.
I think that really it takes a village, and I think that goes to just parenting across the board. I think before I had kids, I had this vision of like I can make lunches and be at every drop-off and every pickup and every holiday party, and the reality is that's why everyone around you, beside you and behind you is so important, because they really, that's what makes it go, is, my friends, my husband, my family, my nanny, all of those things is that's how I get there. Is people say, how do you do it? And I think not by myself. I think that's an important, is to ask for help and take it when you can get it.
Yeah, absolutely. Just learning to let certain tasks go, and learning that you don't have to do everything by yourself is really important. Having family, my husband's super supportive in all of this. So I think it's really important to reach out for help and to accept it. I mean, logistically, one of the things that I wish somebody had told me when I was pregnant was that that when you do take off time for mat leave, you can't contribute to your 401k at that time.
But
so you
really,
need to,
that's not
you need
something
to know
anybody
that.
talks about. That is. I feel like they're the things that no one tells you about childbirth, about maternity leave, about coming back. And that's one that I feel like a lot of people don't talk about, is just how do you contribute to your benefits in your 401k? Because usually you have to pay them fully if you're on an unpaid leave. It just depends on your work.
Yeah, exactly.
One thing that I wish someone would have told me is the power of no. Saying no to something that... I'm a yes person. I say yes a lot. I have a lot of kids, so I'm always trying to be there for each one individually. But it's okay to say no, and that doesn't make me any less of a mom. It doesn't make me any less invested in that child. It's just that I need to make sure that I'm taking care of me, because I certainly can't take care of them without it. Speaking of maternity leave, is there something that you feel like, being in healthcare, being a physician, working in a hospital, that you wish or you felt like childbirth was different, or you expected something different and everybody thought you'd be okay? And
I'm only laughing because I think working in healthcare and not being a clinical person, I think I know just enough to be dangerous. And so what I really relish about, again, working in a hospital system but not being clinical is people like these ladies on my side to say, is this normal? Can you help me? What would you do about this? And because they're moms and they also have the clinical knowledge, it really helps put you at ease. So I feel like I had a lot of support and a lot of understanding, but then it's also, I think childbirth's about recognizing as a parent that you're not in control. And it starts, I think, when you become pregnant. And I had, my first daughter was a C-section, and I had C-sections for all three of my kids. Not planned, just the way it happened.
out.
And I think that is never something I think that you think about when you're going to have a baby, is that, I'm going to have a C-section. I mean, we prepared for everything else, and then that wasn't how it happened. So I think that for me was one thing, is that you just have to let it go, and what you have planned in terms of delivery or pregnancy or all of that is just, you turn it all over because you're not the one in control at that time. So that was one thing I think that was a surprise to me.
just how little control you have.
How little control you have, and it's the beginning of lots of lack of control,
That's true.
times.
That's true.
So, for me, I guess I'm originally from Canada, and one thing that shocks me, especially being in the healthcare system, is the poor maternity benefits. And I just feel exceptionally lucky that I was able to take 3 months after both of my pregnancies, and I know that a lot of people don't have that ability to do that. And I think that's really kind of a sad thing that we are dealing with. And that's a little bothersome.
And it is hard because, that first 3 months is when you're really trying to figure out life for them and for you.
Yeah.
Your family dynamic has changed so much with the addition of 1, 2, 3, however many, whatever that person is. They're adjusting to life, and you are too with them.
Agreed.
So that time is important for your family, and however much you can take.
Yeah, I certainly can't imagine, going back to work after, 6 weeks. It would have been pretty tough. Like, even after 3 months, it was hard enough to come back to work. And I mean, the nice thing for me was that my husband was pretty flexible, and he would actually bring her to work when I first started coming back to work, so that it was, I was still
could
able to spend
see.
some time with her and, feed her and whatnot. But, making that step so early on, if you had to come back to work after 4 or 6 weeks, is pretty tough.
I think so too. With that, if any of you pumped when you came back to work, is there any advice that you could give to a mom who is pumping at work? Because that is tough.
Make sure they give you the time. Make sure they give you the time and a place to do it. Like, that's one thing that I feel lucky about, is because here, in our office, I have my office. And if I was, so we go to different hospitals. If I went to a different hospital, I mean, they're all maternity hospitals that we cover. So there's pumping rooms for the moms, the new moms. So I got to use those. And, you know, I feel lucky because I know that a lot of people go back to work and they don't have that. There should be something built in for these moms. It should not be too difficult. People should not give you a hard time when you need to go and pump. It's important. If that's what you want to do, then it's important.
I think that, like you said, just making the time, you know, I worked like on the floor at a hospital when I went back with my fourth, and you know, sometimes I'm really sorry, but I have to step off the unit for, 20, 30 minutes. And I just made sure that I drew that line of, that's what I'm doing. I'll be back as soon as I can. I think it's really making that time and really saying it's not a choice.
Yeah, I think if you have the ability to have, equipment that is portable, that is hands-free, it certainly did make things easier.
I love the hands-free.
Yeah, I have tried it, in the office before where I'm seeing patients and doing that at the same time. And, whenever it does make a noise, I kind of just pretend that it's not me. But that's, if you're able to do something like that, it's nice. But there are lots of hands-free options with, different brands and whatnot. Just so that you're able to, if you want to do some charting at the same time, even if you're not, seeing patients or doing something surgical, like at least I feel like I'm able to stay productive despite taking.
But I wasn't as lucky as you. I love the system that you have. I didn't have that, but I jury rigged something so I could do my charting and stuff at the same time.
So the important thing is making it work for you.
Yeah,
right?
exactly. Absolutely.